Sara Choi is one of those women. As an ER nurse of more than 15 years and as the owner of her own holistic healthcare practice called Sarang Healing, she jumped into action as the coronavirus began to spread, not only helping patients in her practice and at the New York City hospital she works in, but she came to the aid of healthcare workers on the front lines with whom she was working with side by side.
Now, you are an emergency room nurse. However, you're also a business owner with a holistic healthcare practice. Tell me what happened when the crisis started to hit.
Well, to be honest, we didn't really know what to expect. We were watching what was going on with China and the healthcare systems there. But we didn't know exactly how it would look like here in New York City. So we were preparing the ER for a capacity to expand. But what I was thinking, not just as an ER nurse, but as a holistic nurse, is how can we take care of our healthcare providers during this pandemic? So I come from an experience of 15 years of being in the ER, and as ER nurses and healthcare providers, doctors, PAs, and residents, we have a tendency to care for other people, but don't care for ourselves. And so it sets us up for what we call moral injury and compassion fatigue. And so during this pandemic, I really wanted to prevent that from happening. And so I went to management and I asked them, on the days that I'm not working as an ER nurse, I would like to come in and support my fellow healthcare providers by holding holistic sessions. And in these holistic sessions, I would provide space for them to feel safe through guided meditation and guided sound healing and wellness coaching. And so management was all for it. Especially with what was going on with the healthcare providers across the world, we wanted to make sure that we were taking care of our staff here in New York City. So initially, we met in the courtyard in front of the ER department, and I set up chairs 6 feet apart with no more than 10 people gathered outside. And I had my sound healing instruments, the gong, sound bowls, chimes, things like that. And I used that as an entryway to be able to hold space and support my fellow healthcare providers by giving them an opportunity to feel safe to talk about what they were processing and how they felt through this pandemic. So when I wasn't an ER nurse at the bedside wearing PPE, taking care of patients and family members, I was taking care of my fellow healthcare providers, nurses, techs, doctors, all the people that work in the hospital.
How can you describe what you went through and what so many other healthcare professionals are going through at this time?
It's challenging to put it in words. When we first heard about what was going on in the city, we were, honestly, personally, I was very concerned for my fellow healthcare providers who didn't have PPE. And so I encouraged people to reach out to Congress to really encourage them to support our hospital systems for equipment and PPE. And then from there, it was worrying about ourselves. Like, are we going to contract this? Are we going to be able to stay healthy so that we can continue to care for other patients? It's been a flood of emotions, waves of emotions, days where we are scared for our own health, scared for our family members and our friends. A lot of these healthcare providers can't even see their own children. They're having to live in different apartments or hotels away from their family members. So my heart goes out to them. Also, a lot of our own healthcare providers, our colleagues, have contracted COVID. Some have recovered, others haven't. And so we are taking on all of these concerns and weights and responsibilities of other people and for ourselves and for the community. And it's been challenging. And I will say, for anyone who is listening, it's okay to have different feelings. Some days you'll feel great, other days you'll feel frustrated or sad, and other days you won't know how to feel, and that's okay. You're not alone in this journey.
Do you think that taking care of healthcare providers moving forward is something that you can continue to do with your programming or expand it to other hospitals?
That honestly is a wonderful question, and it's my passion. When I got into holistic nursing, it was because I had a tough time continuing on as an empathetic and compassionate caregiver because I continued through trauma and didn't take care of myself. So my passion is to support other healthcare providers, to inspire them to have self-care moments during their shift and when they go home. A lot of us are told to just keep going, see the next patient, and we don't make the time to take bathroom breaks, or we're understaffed and so we feel guilty for stepping away from the unit to take a lunch break. But honestly, if we're not taking care of ourselves, we're not going to be at our highest capacity to be able to care for other people. So I really do hope that this situation has opened up healthcare management's eyes across the globe to support programs that are concerned for the wellness and well-being of healthcare providers.
Well, Sara, thank you so much for bringing this issue to our attention and for all that you do and continue to do every day. Please stay safe.
Thank you so much for having me.
And if you want to reach out to Sara during this time, she is supporting individuals remotely via phone and video calls. For more information on Sara and her holistic services, including wellness coaching, guided meditation, Reiki, healing touch, M technique, sound healing, and Thai yoga bodywork, visit saranghealing.com. And she's also on Instagram and Facebook. We'll have that info. Coming